Thank you, Prasanna, for the introduction. And thank you so much, Sweta, for setting the standards. So, Dr. Sweta has mentioned about the issues which is related to the regular fundus exam. We need to have the fundus photography. So I'm just going to discuss on these headings about my first camera, slit lamp versus the fundus camera, how useful the LAN connectivity, and is that we are taking care of the patient's precious time, and is that the economics which is involved is going to be a difficult task for us. So this is my first fundus camera. This is a fast, easy, and fully automated fundus camera from Centerview DRS company. Such an workhorse that it is still running even after 10 years of regular usage. So with that, we had, so comfortable. Without the fundus camera, I thought I cannot even practice. Then we moved on to its bigger brother, the AIDON. And of course, we all use the slit lamp for taking the photographs in many ways. But then there are a lot of issues. You can see the slit lamp photograph, how small it is. Of course, we can all take. So this is a Hackstreet slit lamp which I've used. And with the software, we can take the fundus photographs. So you can see the disk size. We can see it's a small area. It's a very vertical slit which covers a small area. Of course, you can see in a dilated people, you can see in a better area coverage can be done. You can see the vessels, you can see the macula. But then the magnification and the width, which you see in the fundus camera, you can see here, such a big area. It can cover minimum of 45 degrees, and it can go to an extent of even 150 degrees of angle in one shot. So you can see the comparison, how small the area which you are going to cover with your fundus examination, regular fundus examination. With the fundus camera, as I mentioned earlier, with one shot you can cover 45 degrees, and with the collage or montage, some of the different equipments use the different ways. So you can go up to the periphery in a wide angle view, and within no time you can use all the filters. With the current fundus cameras, with the higher end fundus cameras, they have the SLO systems. So even in a very small people like 1.8 mm onwards, you can take the fundus photographs comfortably. So even in a small peoples, we can comfortably take the fundus images very clearly. That's the advantage of the AIDON being using the confocal optical system. Even if you have poor quality, images, you can still increase the lightings, and then you can take the fundus. You can see the fundus images properly. That's the advantage of the fundus cameras with the SLO technology. So with the RGB, you can see there are multiple editing tools available given by the company. So you can use the RGB colors, you can use the blue filter, green filter, or red filters. In one shot, you can see all aspects of the fundus. You can see the deeper layers with the same fundus camera. So there are very many studies. You can compare the traditional fundus examination with the our images, fundus examination by the image given by the machines. It is definitely much better, and you can say that the right eye and left eye you can compare straight away. When you see with your regular fundus examination, there is always a confusion of how big was the disc and the neighboring area, how well it is in comparison to the other eye. But when you have the fundus photograph in your clinic, in your computer, then it is very easy for you to compare and see how the things are. So it is easy for you to understand many diagnostics. You can make a lot of diagnosis, additional diagnosis. Looking at the practice flow and the comfort, that is where the LAN connectivity comes. I think nowadays every one of us do have a LAN connectivity in our clinics or the hospitals, whatever the size you have. So you can just connect, the machine gives you the connectivity to your clinic, and you can see the image beautifully with so much of lighting and contrast. It is never, you can never compare this kind of good images with your pictures taken and then you have a hard copy. Definitely it is not comparable. So the pictures which you see here, you can magnify that and zoom it or whatever. You can see every retinal nerve fiber layer clearly. So that is advantage of connecting it to the LAN and seeing that and then explaining it to the patient makes a lot of sense and difference. So is that we have a problem with the time when you're taking the fundus photograph, asking them to patient to go for waiting. But if you really see the timings, there is kind of at least an hour, minimum of 1 hour, the patient will be waiting in the clinic. But if you really ask the patient to go for this fundus imaging, then it is not going to consume any additional time. This is a fully automatic camera. It just takes about a couple of minutes to take the photograph. But just imagine if you are going to dilate the patient and ask the patient to wait, that is going to be much more than what you are taking the fundus photograph. So the timing wise, you don't have to really worry about, there is no difference in the waiting time. And many of us do have a problem of, is that if I'm going to invest on this, am I going to get the returns? Obviously, yes. I don't want to say this as a commercial aspect, but this is just a very simple calculation. Even if you charge very less, if you do more number of patients, then definitely you can get the money back. So it's not a problem of money or what I'm talking here. How much of additional diagnosis that you can make from looking at the fundus photographs, and probably you might ask for more investigations and more procedures are going to be there when you're going to take the fundus photography for sure. We have changed our mind because definitely the yield of information is far more superior, and the way you diagnose your the patient's disease is definitely something different. So let's make a change today. Thank you so much, Prasanna.